Hi, everyone. Welcome to today's Office Hours webinar on virtual Schwartz rounds. It is so wonderful that you've all been able to join us today. Thanks for taking the time out, and thank you too for responding to our call for a community conversation. We're really thrilled that you're all here with us today. I'm Stephanie Adler-Yuan. I'm sure I know most of you, and if not, I recognize all your names. I'm here with a number of members of our membership team. First of all, Beth Lown. Beth, do you want to say hi?
Greetings. Thank you for joining us today.
Thank you. And also on the line without wonderful headshots is Kathy Scopin, our member experience advisor out of California.
Good afternoon, everyone. Thank you for joining us.
Thanks, Kathy. We've also got Michael Goldberg, our scholar in residence.
Hello, welcome. There's no better way to spend a Friday afternoon. Thank you.
Thank you. Thank you. You can say that again. Thanks, Michael. And Casey Kudesia, are you there?
I am. Hi. I hope everyone can hear me. Good to be here.
Thanks, Casey. And some of you know Casey is our newest member of the team, our member experience advisor based out of the Boston area. So fantastic. So with that, I see one question already. Hi, Andy Carlson. You're in listen only mode. Okay, good to know. Well, thank you. Andy has just modeled for us that we can use questions to interact with our speakers and our community here today. And I'm going to go over that in just a minute. But first, I just want to let you all know that this Office Hours webinar, if you've been on our Office Hours webinars over the last few Fridays, we've been convening them more as trainings in talking through our guidance for virtual Schwartz rounds. Today's going to be a little bit different. So we sent out a survey of our membership in relation to virtual Schwartz rounds this week. We want to share with you some of what we learned from that. We also have, in response to what we learned from the survey, updated our guidance for virtual Schwartz rounds. We listened to all of you and what you shared with us, and so we've updated our guidance. And so I'll go over what some of those updates are and what to look for. Then we're going to share some tips. So there were really a wonderful, a slew really of concrete tips that you've all learned around facilitation, around planning VSR, around leveraging technology to your advantage. And we'll share some of those. And then we really would love to invite some conversation, whether that is by chat or by voice. We're really excited to hear some more from all of you on the line. So a few notes. One is, in the handouts pane in your GoToWebinar control panel, probably on the right of your screen, you'll see 3 documents that I've uploaded. One of those is the slides from today's presentation. One of them is our updated guidance. And a third handout is a PowerPoint template that we've created for you to use during your virtual Schwartz round session. So we found that, as you'll hear today, it's helpful to have very clear structure and guidelines for these conversations and explicit ground rules as we do for regular Schwartz rounds. So we've put out a slide template you can adapt for your own organization, but just to give you that sort of skeletal structure. So those are in the handouts. We'll also be posting those on the member community website, both on the VSR page and on our archive page for today's webinar, which will be recorded and posted tomorrow. Next up, if you do have something to say today, you can see in the, my mouse is frozen, but you can see in the attendees panel, I believe, or in the little dashboard on the left, the little icons, there should be a little hand that you can raise if somebody wants to try that. Yeah, thanks, Andy, to show me if you do have something to say at any point, feel free to raise your hand and we'll try to get to you so that everyone can weigh in, and we'll try to unmute you if you're not able to unmute yourself. So that's another thing to keep in mind. You can also use the questions pane, as Andy did, to comment or to ask questions of our presenters. And I'm not sure, is there a chat pane? Andy, since you're using your questions so appropriately, if you all do you also have chat in the attendee view? I'm not sure. Hi, Lara, good to see you. You can let me know. So in the meantime, it's so fantastic you're all here. I even see Samantha from Australia. Can't imagine what time it is there. But if you wouldn't mind, why don't you put something in the chat around who you are and where you're from, and we'll just share a little bit who's on the line today, which would be fantastic. So I know we have Lara calling in from Hawaii. I see Samantha from 5 a.m. in Australia. Jackie, hi, in Texas. Terry in Portland. Hi, Krista. It's nice to see you there in Austin, Texas. I see Ruth in New Jersey and Mary in Ohio. Fantastic. Thank you so much, everyone. Hi, Kim. Kim at University of Kentucky. Kathy McMillan, California, I think, right? Hi, Dan. Oh, you're not Ruth, you're Maureen. Nice to see you. Thanks for joining, Maureen. Thanks, everyone. That's so fantastic. We really have a great representation of the global, really global Schwartz Center community here. So the last thing I'll say is that please do feel free to raise your hand to speak up. But if you're not speaking up, please make sure you're on mute, which I think everyone is by default anyway. And the last thing is, and this I'm modeling for all of you as we convene these virtual sessions, just to please bear with us as we make sure that technology is on our side throughout this conversation. Okay, so first of all, thank you all so much for responding so readily to our survey this week. We had 49 responses when I closed it down to put the slides together, but we had a really nice response. What we heard from all of you is that we've had lots of interest in virtual Schwartz rounds, and obviously each team's response to virtual Schwartz rounds has been related to, I think, where all of you and your organizations are relative to the COVID crisis. So what we heard were that a third of you weren't currently holding virtual Schwartz rounds or planning to. 17% of you have already held virtual Schwartz rounds, and another third of you are planning to hold virtual Schwartz rounds. So that's where we really learned so much from all of you about what you've learned and also what you need. We also heard that where you all were anxious or worried about virtual Schwartz rounds, about a quarter of you were focused on technology. So we've done some thinking and we've asked questions of some of you around how to mitigate that anxiety and get ahead of it. And we'll talk a little bit about that today. Just a couple more hellos to Carol in Boston, Stacy, hi, in Houston, who published some gorgeous poems last week. Thank you for sharing those. And Joanne at UC Irvine. Hi, everyone. So let's see. One of the things that we loved most of all was some of the sort of qualitative feedback you gave us on the survey and some of the moments you shared from your virtual Schwartz rounds. And I thought this might be interesting, especially for those of you who have not yet held these sessions, to see what some of the takeaways and the experiences have been from across our member community. So if you were one of the people who shared these sessions, shared these thoughts, shared these moments, please, and you want to sort of build on what you shared, feel free to raise your hands and I'll invite you to share that. But I just wanted to capture a little bit of this for the community as a whole. So one of you shared with us that an older physician during VSR spoke about expecting to feel afraid during his deployment to the MICU, but instead that he had really reconnected with his motivation to help people, and how touched he was that the team around him really rallied to protect him from direct exposure to COVID. The theme of support that people found and expressed on these sessions was really evident in a number of different ways. I've seen that also on the sessions that I've observed. Someone commented it was beautiful to see how residents in particular supported each other and wanted to be there for each other, drew resilience from that. We heard that two participants on one session bonded over their shared fears of contact with their own spouses on the front lines, and how that was in conflict with their need to really feel connected with their spouses and their experience. And then we heard from someone about on their virtual Schwartz rounds, an intensivist had actually shared in full a poem about his experience. And so we've also seen that, you know, it's not always about sort of speaking extemporaneously, but some people are writing and some people are finding solace in other ways, and they've been sharing that in these sessions as well. One of the bits of feedback that I found especially moving is, I don't know who shared this, it was anonymized when it got to me, but someone commented that I didn't expect VSR to be so vulnerable or so raw. I didn't expect how powerful it was. The virtual nature of the round seemed to matter so much less after a usually quiet team member had opened up to share her personal challenges. vulnerability is still valuable and brave, and even more so these days. And I think that's definitely a theme we've seen, that, we went into this, I think, at the Schwartz Center with a lot of ambivalence about how can we foster connection and community on these virtual platforms. And we've really seen that not only do people take such comfort in connecting with each other in any way these days, but also in a lot of situations we've actually seen that people are sometimes more able to attend, and some of the sessions have been quite large. And so access in some ways to the program has been improved thanks to the virtual platforms. Before I move on, does anyone want to weigh in on that? I don't know, Beth, if you want to share anything else in relation to moments that you've seen or witnessed in the rounds that you've participated in or facilitated.
I think it varies quite a bit depending on how large the group is, how comfortable they are. I have to say I was on a very, very large virtual Schwartz rounds today, and such tender and poignant moments and tears were expressed by so many of the people on that rounds. And it was a difficult topic too. I didn't sign up for this. So I can talk some more about that later, but I think the vulnerability is there. I was really quite moved by that experience today.
Yeah, thank you for sharing that. So in response to some of what you all shared this week, you'll see reflected in the VSR guidance that's posted in handouts here, and that we'll be posting to the website, that we have added more guidance around roles and responsibilities. I want everyone to know that we know that resources are stretched right now. And so the recommendations that we've made are more really around roles than around individuals. But one thing that we've seen consistently across these sessions is that they're very hard to facilitate solo. And so having a co-facilitator who can help you move the conversation along, share different insights, keep an eye on chat, sometimes having a dedicated chat moderator and someone to handle the technology side of things, someone who's competent managing the technology platform that you're on, can really be helpful. So we've put some more guidance and some more detail into those roles and responsibilities and how those shape up in virtual Schwartz rounds versus in standard Schwartz rounds. We've recognized that people need more planning around the technology and support. So we encourage you, if you have the resources, whether from your Schwartz rounds planning committee, maybe your coordinator, someone else on your team who can reach out and make sure you have the IT support within your organization that you feel you need. And some of you will need more of this and some of you will need less, but making sure that you sort of check in with yourself about how much IT support or training you might need to engage with this technology, and soliciting that support is something that people have found a real help. As I mentioned, we've also added a PowerPoint template for your virtual Schwartz rounds, and you can take or leave this. We just wanted to offer it as a resource. We've found that it can be nice for people to have something to look at, and also for those of us who are more visually oriented and less sort of orally, verbally oriented, having those ground rules laid out, giving people a chance to, connect with what the technical aspects of the platform are, just like we did with our, before we get started slide today, try out the chat, try out the hand raising, try out mute and unmute. And so putting that all on the slides can be a fantastic way to open these sessions, spending a little time getting people acclimated, inviting them into this virtual gathering space. And then if you choose to go on video and have everyone on video, that's fantastic too. We've seen that people are coming to the rounds at different times from different locations, on different devices, and not everyone's able to be on video, but if people can, we've seen that it's a really nice thing for everyone to see each other when possible. It feels less like you're talking as I am now, while looking out the window into a void, into a yard. But using video can be a nice way to sort of foster that sense of community. And the last thing we've heard consistently from a number of you is that getting the conversation going, especially with larger groups, can be much more challenging on virtual platforms. And so, we sometimes call them plants in our Schwartz rounds or discussion catalysts. I don't know, now we're landing on discussion boosters. But having a few folks who will be on the session, maybe they're on your planning committee, maybe you work with them, maybe you've extended an invitation to them, but having a couple people on the line who you can turn to get the conversation going, to share their own experiences, to model participation. So we've added some additional detail on that front to the guidance for VSR as well. And if there's anything else, I'm going to share some of the tips that you all shared with us through the survey. But if there's anything else that you would like to see us build into the formal guidance, please just let us know, because it's been really interesting to see sort of across our membership what's been sort of surfacing as consistent. I don't know if I'm confident enough to call them best practices just yet, but consistent good practices. Kathy, I see your question, and I'm going to hold on it for a little bit, and we'll come back to that if that's okay. So thank you for sharing that. Okay, so let's get on to some of these tips. I loved this because you were all focused on different things. Okay, sorry, I see one more question. I'm modeling, trying to be patient with myself as I adapt to this technology. This is great. Thanks, Andy, for sharing your comment. I'm going to sit on that for a little bit too, if that's okay. Okay, so some technology tips from our community. Number one, be patient with yourself as you adapt. Self-compassion obviously is one of our core values, and I think that applies now more than ever. So we're all getting used to this, and opening these sessions with a note of humility that we're going to do our best. It's not going to be the same as when we convene in person, but we still hope that you'll derive some value from it. And having someone on hand to answer any questions that come up around the technology in the chat can be really helpful as well. Get as many people to use video as possible. I would say invite as many people to use video as possible. Faces do matter. That was someone's comment. Andy just shared a comment that I'll read it if it's okay. I've led 2 sessions so far, and each time about 2/3 of participants elected to have cameras off and seem to want to observe more than participate. Topic has been managing anxiety in ourselves and our family. And I think that's probably somewhat consistent with what I've seen elsewhere. I think extending that invitation and having folks on the line who can model video participation can be helpful, but also obviously welcoming people to come as they are, right? And whether they're more comfortable speaking or using chat to participate. We really just want to be as inclusive as possible. Okay, Beth, I'll leave the questions to you for now. It was challenging, Andy. I bet it was challenging. So let's talk more about that. Having several facilitators, I alluded to this already, but this obviously depends on what the resources are that you're able to deploy for virtual Schwartz rounds. Some ways you might think about these roles is that, having someone to manage chat, which Beth is going to do now, keeping an eye on our questions. Having someone on, especially with a large group, if everyone's automatically muted by default, you can use one of your moderators to, you can even just assign someone the task of muting and unmuting people when you call on them. You might have someone who's really focused not on the chat, not on the technology, but just on connecting, just on relating, really focusing on staying present in the discussion, connecting themes and ideas. In the rounds that I've observed, I found that having 2 people who are focused on the conversation can keep it a conversation even when people aren't participating as often. Someone commented that they had people click the raise hand function, which I copied here today, just to practice. The other thing you can do is invite people to use chat to share, what their function is, where they're connecting from. But raising hands during a discussion can help to ensure that folks won't talk over each other. That's fantastic advice. Then on to planning tips. So someone commented that, making sure there's full access details included in the invitation so people don't have to go through too many emails to figure out how to log on. Someone pointed out, which again, I totally agree with, allocating enough time at the beginning of every single session to go over the ground rules and reintroduce the technology is a great thing to do, keeping in mind that you will definitely have people who are new to the sessions, who are new to Schwartz as well. So introducing how this program fits into the broader Schwartz program, reintroducing Schwartz each time. One of our wonderful speakers, I don't know if she's on the line, one of our wonderful facilitators, Wendy from Alabama, has had a few sessions, has facilitated a few sessions, and noted that although the themed conversations have gone well, she's noted that when she has scheduled speakers to launch the conversation, it seemed to work better for her. I'd be really interested to hear what some other of you are seeing on that front. Oh, and then my facilitator point is here twice. Sorry about that. I see that as sort of a technology and planning tip, I guess. It's a facilitation tip too, I think, actually. And then we get into facilitation tips. So providing a prompt for the audience in your invitation, I think that's a fantastic idea because it I think can mitigate some of the anxiety around what is this conversation going to be. So if you do have a theme for your Schwartz or a title for your Schwartz, your virtual Schwartz, maybe offering that prompt, we'll be talking about managing anxiety in ourselves and our family members, so letting people know sort of where the conversation will at least get started, if not be entirely focused. As I mentioned, a few people have said it's harder to get people talking, so having those discussion boosters identified and understanding yourself, checking in with yourself about how you'll manage silence and what you'll do when you are done with the silence is a great thing to do. And for any of you on the line who are silence oriented people, I'm looking at you, Greg and Krista and others. If you have any tips for managing silence online and how that's different from managing it in person, we would love to hear those. Starting with distressing topics and ending with coping skills. So I loved this. We've spoken in our other virtual Schwartz webinars about the narrative flow of virtual Schwartz in contrast to or in comparison with the narrative flow of standard Schwartz. And I think this is a really important point to think about sort of where we want to find ourselves at the end. So thinking about how we're going to intentionally pivot our conversations to leave people in a place where if they don't feel good, maybe they feel a little bit better. And we're, giving them time to recover from what might be more difficult aspects of the conversation. I'll say that if you are interested in thinking more about facilitation techniques and the narrative flow and narrative phases of virtual Schwartz, I encourage you to go onto our member website and watch one of our office hours from the last 2 weeks because we really go into a lot of detail there. We're not doing that today, but it is also in the virtual Schwartz guidance. Being sure to acknowledge comments either verbally or in the chat. So making sure that anyone who says something is responded to. And the last thing I loved here is someone shared, don't be afraid, just do it. And really, people were so grateful for a place to share. So Kathy, you asked earlier, has anyone had participants who are really angry who have spoken? We've had one VSR and people are nervous about providing an open mic for unhappy employees. So maybe this was your comment, but I wonder if, we have to open ourselves to some of this risk in order to see the benefit that we're hoping to attain, so or to realize. So I'd be curious if anyone's had any issues with challenging conversations, contrary opinions, anger, difficult feelings, especially difficult feelings or disruptive feelings on the sessions. We'd love to hear more about that. Oh, thanks. Krista had a little, oh, that's great. Krista commented that included in her guidelines were general ground rules about what wouldn't be addressed during the session. So not just what we will be talking about, what's in scope, but also what's not in scope, for instance, like federal policy and politics and things like that. That's really helpful. Thanks, Krista. And then you can always point back to that should any of those challenging issues arise. So I really did want to spend the majority of today in conversation if possible, but I did want to also point to some additional resources that are available to all of you, some of which I've alluded to here today. The Schwartz Center member website, obviously, if you don't know your organization code to log in, although you must if you're on this webinar, you can always reach out to your member experience advisor. I'm sure you all know who that is because you heard from us this week, but I work with our members in the greater New York area. Kathy works with our members in 2/3 of the country from the west to Ohio, and Casey's on the East Coast and in the South. So if you have any questions, you can always reach out to me. But we're always here to serve as a sounding board, or if there's anything else you need in regard to this program or any others. We've also found that across our organizations outside of Schwartz Rounds, our COVID-19 resources page has been really helpful. We've been trying to keep that fresh and up to date. And one of the things you'll find on there is information about our upcoming Compassion in Action webinars. We've actually been holding these weekly, and we'll continue to do so through May, I believe, with some really world-class speakers. So we have one coming up this week. These are free of charge. They're not CME CEU accredited, although we do send a certificate if that's of any use to you that you attended. We'll have Dr. Patricia Watson and Dr. Richard Westfall speaking this week about the Stress First Aid program in relation to patient and family support. After that, we have Tony Back of Vital Talk out of University of Washington, who's going to be talking about communication in the age of COVID. Registration for both of those is open right now, and you can feel free to share those across your organizations and beyond through your professional networks. They're always recorded and posted on our website afterwards. And then our virtual Schwartz Rounds guidance, we're continuing to update on a regular weekly basis, and we'll continue holding these webinars as well on Fridays for as long as you all want them and need them and benefit from them. So with that, I think we'll move on to our discussion portion. And I'll hand it over to you, Beth, and I'll invite everyone to raise your hands if you'd like to say something, and I can unmute you and we'll call on you, okay?
Thanks, Deb. So we're I'm gonna try to sort of do a virtual Schwartz Rounds using this platform, I guess. But we really want to hear about your experiences if you have done virtual Schwartz Rounds. Share your experiences with us. And if you haven't and you still have some concerns that staff hasn't addressed, or you just want more support, now's the time to speak. Now, Steph, you're okay. So I see a hand. I can't quite figure out how to raise your hand in there, but I'll get a tutorial later.
Yeah, Joanna, I've got you. I think you're unmuted.
Yes, thank you so much. And thank you for doing these. They're so helpful and informative and full of support as well. So I just wanted to share what happened at our first virtual Schwartz Rounds because it did involve a lot of tricky decisions that we weren't sure about. When we found out, we had already thought of doing a virtual Schwartz Rounds before we knew that Schwartz Rounds was providing all this fabulous support. So we had structured it similar to regular Schwartz Rounds with a panel, an interdisciplinary panel of physician, nurse manager, chaplain, and social worker. And and one of the most difficult decisions we made is, since this was our first virtual Schwartz Rounds, we invited hospital leadership, the dean of the School of Medicine, the CME, and stuff like that, to attend and speak. And that was a tricky decision because we didn't want to stifle concern and free expression of feelings. We really wanted leadership to hear the voices of our people, and it actually worked out amazingly well. We were very fortunate to be able to prep our leadership and sort of kind of orient them to what Schwartz Rounds was all about, and some had taken an interest, like director of nursing, but others maybe not so much. But it did work out as we expected, and the leadership actually fell into place. They told some very moving stories themselves about their personal encounters with COVID-19. One of our leadership had lost a dear friend, and we felt that although we didn't get as good participation as we wanted, when people did participate, they seemed quite open. So I'm just throwing that out there. You know, you can argue both sides of that, but it was interesting.
Johanna, I can't believe how brave you were to do that on your very first one. That's pretty awesome. That's quite amazing.
I mean, I'll just say this one more thing and then be quiet. You can put me back on mute. But yeah, and I just want to make people aware that we were very aware that it could backfire. And I still have mixed feelings about it. But again, as best we could read it, it created a deeper sense of community, you know, and that's one of the big rifts always is between leadership and people on the ground on the front lines. So in this case, it worked, but I could definitely see it not working.
I'm curious how you actually prep them. You asked them to jump on a phone call with you, and who did you invite? Was this the entire C-suite or what?
No, there were, let's see, there was the medical director of the hospital, the director of nursing, and then, of course, good timing, our chief administrative officer for the hospital is changing. So we had both the old guy and the new guy. And I'm a facilitator for our Schwartz Rounds. And so the medical director, Dr. Cindy Hawk, and I talked at some length about how to prep our superiors, you know, without insulting them or muzzling them. But we did it mostly by email and phone on an individual basis. And as I said, our director of nursing is a big proponent of Schwartz and really gets it. Oh, I'm sorry. And there was also the dean of the School of Medicine there. Yeah, sorry. So, but, you know, our main point was we didn't want them to kind of cheerlead for the hospital and kind of just say things that people might not feel were very transparent or honest. And we tried to get that message across in a tactful way. And somehow it seems like we did. So I felt very relieved. And they only spoke, like each person spoke for about a minute and a half, 2 minutes. And so it was a very short part of our Schwartz Rounds. And it's not going to be a standard part of our VSR, but we thought on balance it was good.
That's fantastic. Kudos to you guys, really. Thank you.
Oh, and I will say just one more thing, Pat. We had been doing Schwartz Rounds every other month, so 6 per year. And afterwards, leadership asked us to up it to once a month.
Yeah, I'm seeing that a lot as well. Yeah, exactly. Thank you. Other comments, other experiences, challenging and otherwise?
I see Julianne on the line. Julianne, I'll unmute you. And then I want to share one of the questions that came in the questions pane.
Yeah.
I think I unmuted Julianne. You might need to unmute yourself as well.
Okay.
There you go.
Oh, we go.
Hi.
Yep.
Thank you so much for the program. So we have been doing Schwartz Rounds at Atlantic Care for, oh gosh, at least 4 years now. And it's been very well supported by our leadership, in particular our nursing leadership. So when things got very busy with the pandemic, nursing leadership asked us to begin Schwartz rounds as a conference line experience. And so they kind of moved in that direction even before the Schwartz organization did. And they also asked us to consider weekly conference line rounds. So we jumped in kind of by the seat of our pants. And our team looked at this as an opportunity to provide some, not only some processing about the experiences on the units, but also to, just look at some of the ways that we can come together as a team and deal with things. Our first speaker that we had was one of our senior leaders in nursing, and she had been doing leadership rounding on the units. So she talked about some of her experiences, what she saw on the units, not only like the good stuff, seeing people really serve with excellence and, some of their struggles, but also talking to some of our staff who were really deeply concerned and almost, in tears on the units because they were afraid about bringing a virus home to immunocompromised family members.
Mm.
So she was really, heartbreaking to hear. But when we talked to her, I remember just kind of doing what we do in rounds, which is, you tell your story, but then we want to also hear how it's affecting what you've dealt with, how it's affecting you on a personal level. So we were able to kind of get her to go deeper with her story.
Mm.
And after she was able to kind of look into herself on a deeper level and make it personal, then our lines flooded with other people talking about their experiences, and we had a great discussion. We have always been, unit or hospital based, so we moved our program from one of our hospitals to the next. We have 2 hospital campuses, but with the conference line, we opened up to all of our Atlanticare system, so our program grew. So we've since we're doing weekly sessions, we focused for a couple of weeks on a lot of anxiety and coping, on a couple of different focused levels, with anxiety around serving while dealing with things. But I think really, we touch in the beginning about the anxiety issues, but most of our program really is more focusing on how we deal with it.
Mm-hmm.
So, I guess if you look at the model, it's more, focusing on the Band-Aids rather than opening up the wounds, which I don't think that's our own anxiety so much as just kind of a gut feeling that we don't want to do too much opening up when we're not in a, present with people physically. My co-chair is the director of psychiatry and behavioral health. And I've got some of that background too. So we just feel like we want to take that model where we're doing more building resilience. But we've looked at a couple of different, specific issues each week, and we invite different leaders in to tell their stories too. And that seems to help draw people also. But some of the topics are a little more heavy. But like next week, we're going to have someone in who takes care of like our dietary work, and she's going to talk about eating healthy during the pandemic. So yeah, so it's been really wild and fun. But I find I have to go back and look at a lot of your information, and maybe we can do a lot better now with our tech, because we jumped in so fast. I think we're really, really low tech with our program, but we can probably do a lot more.
Well, thank you for sharing that. That was really, these stories are so helpful and so remarkable. I mean, your courage and your bravery in launching, in this way, because there are a lot of unknowns. And I think it's kind of parallels our desire to, jump into the front lines. We really want to jump in and be able to help. And I think what really stood out for me, Julianne, is once somebody is able to self-disclose and really talk about what they were feeling, and especially if it's someone in a position of leadership, it really does open up the floodgates. It enables, it gives permission for others to speak as well. So thank you for sharing that. Also, just do want to point out that in our guide, we embedded this model that we have been doing the webinars on. So many of our webinars are focused on stress first aid. Some of you may have attended them, but we're following their advice, which is to try to embed in all of your rounds these 5 essential elements that people really need to recover from adversity and stress. So you'll see that in our guide. It includes things like calming, calm, being able to help people calm, feel connected, feel competent and confident in the work that they're doing, and so on and so forth. So the model beginning with, yes, sharing your concerns, your fears, your anxieties, your challenges, and then moving towards a place of calming connection, support, and just a sense of community is embedded in the regular narrative flow of Schwartz rounds, and especially very, very important now in virtual Schwartz rounds. So we have some more questions, I think.
We do. You know what, Beth, before we jump into, I see a few hands raised, but I just want to answer a couple of questions that have come in on the questions pane. So
Yeah.
Catherine, Christina, and Joe have related questions that have to do with technology. Catherine says that they'd like to make their VSR very interactive, for instance, including polling questions throughout the presentation, and what would be the best platform to use in order to do this. Christina's related question says that they have access to WebEx, which has video and audio-visual connections, but have trouble figuring out how to allow nurses and unit managers to access it because they don't have offices or laptops. So they have problems with accessing the technology. So starting with Catherine, for interactivity, one of the reasons we haven't been able to be more directive and give you more support, frankly, around technologies because everyone has access to different platforms. So to answer Catherine's question about interactivity, I personally find that Zoom is highly interactive and very easy to use. There's also a healthcare version that that supports like HIPAA privacy guidelines and other things too. So if you do have access to Zoom, the polling function, the chat, and also the breakout rooms are all really easy to use and fantastic for fostering discussion. I know that some folks, Christina, on the line have experience with WebEx. I don't, but if anybody wants to write a note in the comments about their experience with WebEx, I'd be happy to share that. It is challenging when people need to call in from desk phones, and she notes that personal phones are discouraged as disease vectors. So do we have any suggestions for getting more people access to video technology? Beth, I don't know if this is something you've seen. That is definitely a tough one.
It is a tough one. I mean, the ones that I've facilitated, it's a problem because people are generally, if they can sign on, they're signing on sometimes from the wards. There's no camera, there's no nothing, and unless they take off their phones, they can't really communicate or speak. I mean, some centers may have more advanced technology than we do, but ours is pretty crummy.
Yeah, so Samantha notes that she's used Zoom, which can be accessed easily on mobile phones, which makes it easier for all, especially folks who may be at home, between shifts. I think that The other thing we just heard from Julianne really is that you can still have these conversations when people aren't on video, and people can still derive some comfort and some value from that. So that's something to note as well, that it's not worth doing if you can't access that video enabled technology. And then Jeff also adds that he's used polls on Zoom and it was very easy for him to use. So thank you for sharing that. Jeff, Joanna has asked for an example of using polling function in virtual Schwartz rounds. So if you have any questions that you've asked that have been effective, I actually have a poll built into this session to take the pulse on where you all are relative to virtual Schwartz rounds, but I don't think we needed it here today. And Krista notes that chat can be really important for supporting interactivity. Is that what you mean, Krista? You can tell me if that's what you mean. And they use chat a lot. These are all really helpful. Thank you. The last one before we go to everyone's hands is that Joe asks about recording VSR for those who can't participate live. And this is something that's come up a few times. She notes the need to balance the creating and protecting a sacred space and support privacy and confidentiality, but also being able to share more widely with frontline staff who might not be able to participate. Beth, what are your thoughts on that?
Yeah, I so get the dilemma, and I just feel like I don't think we can do that. It just feels so difficult because we try to be sure that whatever is said inside of Schwartz rounds stays inside of Schwartz rounds, meaning amongst those who have spoken. And our job is to protect not only the confidentiality of patients and families, but our colleagues who make themselves vulnerable and choose to speak. So I think it would seriously be a problem to record. And we're really encouraging people not to record the Schwartz rounds because it makes privacy and confidentiality really, really tough to safeguard.
Yeah, I'll say that I've been working with in my other hat with the narrative medicine program at Columbia to support some virtual sessions. And what we've been doing is writing summaries of the sessions to share online and allowing people also to post thoughts or reflections that they might have relevant to the sections, which you can look at narrativemedicine.blog. So you see little summaries of all the sessions. I think that might be another way to let folks know that support is out there, to convey the idea that they're not alone. Even if you're not saying exactly what happens in a virtual Schwartz rounds, you can at least note that these sessions are happening. Maybe you can note additional resources for support that are available to staff. And that also might extend the invitation to more staff who haven't attended yet. So that's a thought too.
Yeah, Steph, I'll just piggyback on that. You can summarize the themes because we do say to people, we love to have these conversations continued outside the boundaries of Schwartz rounds, but without mentioning who said what during the Schwartz round. So you can continue the conversation about the themes.
Yeah, absolutely. And to get back to Joanna on what polls Jeff has used, he's used "How are you feeling?" And one more that "How are you feeling right now?" So taking temperature on where people are. And you had one more, but I deleted it by accident. I'm sorry. Okay, so we have about 13 minutes left. We have some really lovely people's hands up. So let's go. I think, Greg, you were first. So I'm going to unmute you. I hope you remember what you were going to say.
Oh, hey there. Thank you.
Hi.
Since Stephanie, you called me out, I figured I should say something about the silence thing.
Thank you.
You're welcome. So we've done one virtual Schwartz rounds, and it was because it was brand new. We didn't know how it was going to go, and sometimes our committee, I'm the facilitator, and sometimes they tease me a little bit about the silence thing because I'm probably willing to tolerate more silence than some other people are, and it generally works out. But one thing we decided to do, and I said when we did this one, was that that if we had, if it ended up people didn't have a lot to say or feedback, or there's a good deal of silence, that we'd just end it early. We wouldn't worry about it because we didn't want to. We thought that it was going to be more difficult to deal with, or to tolerate or feel comfortable with in the virtual way. It ended up that we didn't have that concern. We ended up having plenty of participation all the way to the end, and we could have gone longer. But that was our plan ahead of time, that if it looked like it got too quiet for too long, we would just thank everybody for coming and end early and not stress about it.
So kind of giving yourself permission to just let whatever happens and be compassionate with yourself, Greg.
Yeah, I think so.
That's great.
Yeah, you know, in a typical one, you know, we might, and this could still happen in this way, but you know, I might survey the room and see somebody and invite them to, you know, to help us out and something like that. But this was not the same. I couldn't see the whole room, and we didn't want to be locked into doing it exactly the same way if it wasn't working out.
Right. That's a great tip. Thank you.
Thanks.
You're
That's
welcome.
awesome. Thank you. Sorry I called you out, but I appreciate
Well,
it.
I don't mind. Anytime.
Thank you. I also called out Krista, who also gamely put her hand up. So let's see if we can unmute you, Krista.
Okay, am I unmuted now? Yeah.
Yes, you are.
Okay, so we started these back in March on the 19th. We've been doing about 3 to 4 a week. A little bit different format than Schwartz runs, but pretty close to what we're talking about, honestly, now that I'm thinking through it. And this has been super helpful, by the way. So we started out doing them for an hour, and we were also worried about silence. But we start with a 1 to 2 minute kind of calming exercise at the beginning, and it just sort of gets everybody settled. It's not super woo-woo, but it's a little bit of just kind of getting them kind of centered in their bodies, and people have appreciated that. We've also asked for feedback from folks after all of these, because we kind of wanted to see what was working and what was not. And what people have said is they liked having a calming exercise because they arrived in the space pretty activated in their nervous system, just because of life right now. And then they liked ending it with some sort of exercise at the end, something brief, but something to give them sort of like, here's a tool you can use while you're in the room with the COVID patients, you know, like how do you stay grounded? And so, which is different than we would normally have done in a regular Schwartz Rounds Live. So that, just want to give you that feedback. The other thing we started this week, we were finding, because we've been doing them for so long, that attendance was tapering off for an hour. So we've cut them down to 30 minutes. And this week we decided to say it's 30 minutes, and at the end of 30 minutes, we're having an after party. So basically that meant you come on for 30 minutes, we call time at the end of 30 minutes. If you have more time and want to stay on, you stay on. And we talked, and people have stayed on, but it gave permission, if they had 30-minute lunch break or they had a 30-minute window, that they could be comfortable jumping in and not feeling obligated for an hour. And so that's been cool. That's been really cool. And calling it the after party just made it kind of silly, but people have stayed on. And then the last thing I would say is, and then getting feedback has been helpful for us. So we just sent out a quick feedback form at the end, and people have been telling us what they liked and didn't. You know, they've all been telling us they like it, but you know, I think they just want to connect. Really, that's what is important about Schwartz Rounds anyway. It's about the connection in the community. But the last thing I would say quickly is chat. The chat space has given people that are introverted or people that want to remain anonymous because they've come in on their phone or they've come in from an office phone in the hospital. They don't have to identify themselves, but they can chat in, and they've liked that. And so it's given people a chance for even more anonymity. And so we read the chat out to the rest of the people that may not be seeing it on the screen. And that's been very engaging, especially when there's moments of silence. So that's been super cool, because you don't have that in live Schwartz Rounds. And I feel like we're attracting a different voice that we don't always hear in the live setting.
It can actually be more inclusive, you know, it's interesting, isn't it? And also, I think many more people are attending in some programs. I think the programs are growing. People are coming who never would have come before. And in part, you know, some of the folks, especially in the outer clinics and things like that, are attending who don't necessarily come to the hospitals anymore. Some of the PCPs and, you know, folks like that. So there may be some.
It's told us we've got to do this afterwards. People have said, don't stop. If COVID, don't stop. So now we're trying to figure out, what does that look like? Because I mean, but yeah, because it is. That's exactly right. It's calling these people in from way outside of our box, and their voices are really, really important. We've had nurses from the school districts calling in who are very affected by this because they can't see their kids anymore. And they're really troubled by what's happening in their homes.
Wow. That's pretty incredible. Well, Steph, I'm just checking, doing a time check here. What's your thought here?
Yeah, I'd love to make time for one more comment if we can, and I'm also happy to hang out for a little bit longer if anybody wants to stay on. But I want to try to wrap up formally. I'll borrow Krista's after party. I'll stay on for a 10-minute after party.
I love that idea.
I do too. It's now a Schwartz Center best practice. So Amanda, if you to take a minute, we'll have one more comment. I'll unmute you. And then if we haven't gotten to your question, I just want to extend an invitation to please follow up with us either at the after party or by email. But Amanda, you're there? Yeah? Amanda, you should be unmuted if this works.
Does she need to unmute herself?
Oh, I don't know. It looks like she's unmuted. All right. Okay. That might be a no-go. Oh, I'm sorry. Try to use the questions pane if you can. With that, I'm going to just ask Samantha's question, which is in the questions pane, which is if anyone has any advice, and maybe Beth, you want to weigh in on ensuring that those participating are safe or okay, checking in after an emotional conversation.
I mean, I think this is very much like what we would do. I'm assuming you're Sam, that you're thinking about checking in on the emotional safety of someone who might have self-disclosed or made themselves vulnerable. And this is really, I don't think, too much different. If you know who that person is and you feel like you can reach out to that person to see if they're okay, whether by an email or a text or something like that, I think that's totally fine to do. And if you don't know that person, you might be able to ask someone else from your planning committee, somebody else who might know the person or, what unit they're on and so forth. So I would say, yeah, definitely reach out. Particularly if someone looks like they're really in need of some additional support. That's so important right now, to be on the alert for anyone who's maybe more stressed than you might expect, although that's hard to imagine, where that tipping point might be. But still, I think we want to be aware and mindful of who might be exhibiting stress symptoms or stress injury symptoms, as our trainers would say in stress first aid, and help them feel that you're there for them, that you can listen and you can offer support. And if they feel they need additional help, to help them to get to additional help and support. I hope that answers the question.
Yeah, thank you for that. To Samantha, thank you for waking up early. We're so glad that you're able to join us.
Oh my God, 5 in the morning.
And Krista noted in response to your question, Samantha, that they were worried about that as well, and it hasn't been as big as they would thought. Folks have written that they feel better and just needed to express themselves. So I hope that I think that was a response to your comment. I know we didn't get to everyone's comments today. I'm really grateful that you all joined us. We'll be doing this again next Friday, and you also know, I think, where to find me and Kathy and Casey if anything comes up for you in the meantime. We can't thank you enough for your collaboration on this and on really rising to respond to the need. Deborah asks about focusing on a theme or letting it go grassroots. I'll hang out if you want to talk about that for a minute, but I want to let everyone go. And thank you all for your time today and for everything you're doing in this really incredibly challenging moment. We'll definitely be in very close touch, and just take care, everybody. So if you need to go, please go. And if you want to hang out and ask more questions or raise your hand, you can feel absolutely free.
Thanks for coming, everyone.
Yes, thank you. Okay, so Deborah, I see that your hand is raised. This is the after party. Hi, Deborah, how are you?
Hi there. Sorry, I just came in at the discussion part, so I missed the presentation. You may have already covered that. we're just going to get ours started next month, truthfully, because we were on a pause, but we know we need it. And so we've never done the technological. We'll get that part figured out. I'm just curious about, do you always have a theme, or do you just start out letting people say, hey, where's everybody at? Or is that too wild?
Yeah, why don't you take that one?
Yeah, I can speak to that. I think you'll have better success if you have a theme. You may just want to start with a check-in. How's everybody feeling? Does anybody want to share, something that's top of mind before we get going on our theme? And if there are no takers, then you can go straight to the theme.
Okay, and if there are takers, it may just take loose, because I think there's a craving right now, and we're going to be starting it kind of late. So I almost envision the first one just by saying how everyone's feeling. It might take off from there and not even get to a theme.
Yeah, that's
But
possible.
I might be wrong. Okay.
No, it's quite possible. And I guess you can just sort of play things by ear or decide with your planning team, with a co-facilitator. Do you want to steer towards the theme, or do you just want to let things go? I think the more important thing is to have in your mind an arc where you allow people to start with the troublesome things, and then you make sure you end up by enabling people to share what's been useful for them, how are they staying calm, connected, supported, et cetera, et cetera.
Yes. No, that's of course extremely important. I appreciate that very much.
Sure.
And did you find there was like a facility, because we're going to do one outpatient, one inpatient, and of course everybody's isolated. So in the groups, people like to see each other, groups in even 10. If they're going to have a room of 10, does there need to be a facilitator in each room where that happens then?
You mean breakout sessions?
Well, we were debating breakout sessions or physically having a physical facilitator at sites where they could put 10 people in one room.
Huh.
People are missing seeing each other.
Yeah. I mean, if that's now permitted, according to,
we're allowed 10 in a room, meetings of 10 if they're 6 feet apart.
Yeah. Well, if that's part of policy and people can stay, abide by the guidelines, and you have the bandwidth and the number of facilitators, I think that's fantastic. Go for it.
All right. Well, we'll let you know how it goes. Like I said, we're spending this next month. We're spending this next month planning because we were on a break. And,
well, if you need anything,
we've been doing a lot of other psych support tools that aren't Schwartz, but there's a hunger for Schwartz.
Yeah.
Okay.
If you need anything, you know where to find us, and the guidance has a bunch of themes that if you do decide to go in that direction.
Yeah, no, I just looked at all the handouts and I just love the template that you put together to give it some form too. So that's something visual to get people started since they've never done this before. Excellent tool. Thank you so much.
And Krista at Dell Children's, she noted that themes have been helpful for them there. So I just wanted to add that. That's in the quote in the chat. Response to your question.
Yeah. No, I'm glad that as a planning committee, we would certainly have that in our ARC if we get, what does someone call it? Crickets.
Yes.
Open up lines.
Virtual crickets.
All right. Well, thank you so much. I appreciate it. I'm actually late to another meeting, so I'm going to sign off.
Thanks for joining.
Thank you. Sure.
And if no one else has any comments or questions, we'll sign off as well and close our after party. But thank you everyone for this. Thank you for Krista. Thank you to Krista for the after party idea. And we'll hope to be in touch very soon. So take care, everybody.